Okay, so 100 questions, multiple choice, 2 versions, A and B. Whatever Sean gives you on Friday, the Monday group will get the other one. The exam will cover everything that has been talked about in class, starting with day 1, very first activity. What did you guys do?
Measure vitals.
Blood circulation.
Yep, so we're starting there, okay? So start by knowing that, and if you know that, you're gonna make it a lot easier through the first section of Module 1 with all of the anatomy and physiology of the cardiac and the respiratory systems. You need to know about, when we talked about the location of items in regards to other structures. So like, where is your heart located in regards to which ribs? Do you listen to different types of valves opening and closing and things of that nature? Know about the differences between different stages of ulcers that we talked about last class. Know about, like, this, when I say about the different stages, like what layers of skin are impacted with the different thicknesses of injury, or ulcers or burns. Let's talk about lymphatic system being blocked in some way, shape, or form with like primary lymphedema and secondary lymphedema. Motor neuropathies, alternate names for the different valves in the heart. Just know all your anatomy of all of the different systems for the cardiac, the pulmonary, the lymphatic, and the integumentary. If you know your anatomy, you'll do a whole lot better. Because that'll be really, really helpful when we get back into those postural drainage positions, where you have to figure out, like, okay, where does that lobe reside and how do I have to tilt the body to make that lobe be perpendicular to the floor so that I can get gravity to help drain it when I do my percussion, and where do I percuss over that area of what part of that body. We talked about tracheas and pharynxes and larynxes and lymphangions and different types of coronary arteries and where they originate and what parts of the heart they serve, and pressure sores and how long things can last before breakdown happens, and how often we should be moving people, and what the signs are for breakdown. Let's see. Today last class period, we kind of talked about the different coloring on the wounds that I gave you some samples of. There were like red healthy tissues, there were like yellowy not so healthy infected type tissues, and then there were black like eschar dead tissues. So we appropriately call that the red, yellow, black system configure. And so you need to know kind of how those tissues are classified. So like if I told you like there was a black tissue, what would you classify it as? How would you describe it to me? What would you try to do to that tissue? How about phases of healing with the inflammatory proliferation, maturation. We talked a lot about blood pressure. We talked a lot about blood pressure in regards to cardiac medications, and how if you're on certain cardiac medications, you can't measure how a patient's doing always by heart rate. You have to look at other things, and some of those other things might be what? Anybody? What are our vitals that we monitor?
Blood pressure, oxygen,
respiration rate.
Okay, so if I'm on a beta blocker, what am I not able to go by?
heart
What
rate,
should I go by?
blood pressure.
Blood pressure, possible. Signs of a heart attack. You need to know when angiogenesis and granulation occur, how long wound healing can last, all about orthostatic hypotension, what it is, how to help fix it, what numbers you would expect to see if somebody had an episode, how those numbers would trend. Lots about wound healing, the amounts of the different gases that happen to be in the area, what happens as those gases move around. A lot of the stuff from the slides today about like the nutrition with the metabolic changes, things like that. Patients in a certain position, what body parts most likely to have breakdown or pressure sores develop, what structures are involved in inspiration, what structures are involved in expiration, what are active ones, what are passive ones, what about forced inspiration or forced expiration. We talked about aspiration causing some stuff, and that aspiration can also be caused by some conditions when we talked about different medical conditions. So we talked about a lot of cardiac conditions, we talked about pulmonary conditions, we talked about central nervous system conditions, that all can have an impact in that ability to breathe and swallow and things like that. Crossover from neuro, a little sympathetic nervous system information was presented, so go back and take a look at that and how it impacts some of our vital signs. Rule of nines from today. Artery wall thickness and how it responds to blood pressure, how it responds with like a high cholesterol or a, plaque deposits or fatty deposits in there. Absolute contraindications to exercise. Remember that from module 1 where we had a long list of things that we screened our patients for, or that you screened each other for. We talked about frog breathing, what it is, when it's appropriate to use, know how to describe it, know when it's appropriate to consider it as a breathing technique. Go back in and look at your ventilation stuff with your forced ventilation and your invasive versus non-invasive ventilation. More math for you. If I give you a patient and tell you how old they are, we want to do age predicted heart rate. Remember, you guys had to do that like, I don't know, day 2 or something like that. You know how to figure that out with your old school, old fashioned calculator I'm allowing you to take. Not your cell phone, not your neighbor's cell phone either. Types of insufficiency for lower extremities, where we talked about like venous insufficiency and arterial insufficiency. Know the differences, know the signs of each, know kind of what to expect with each one of those situations. If I describe a patient for you, be able to tell me if you think it's a venous or an arterial insufficiency. Heart sounds, we listened to different locations and they were labeled S1, S2, S3, S4. Know where they are, how to locate them, and what sound you hear at each one of those spots. So if you're listening for, the mitral valve, where would you listen to it? Things like that. How does your body respond to exercise? So we did lots of labs on this, and you tracked your vital signs. What's normal for changes in vitals, what's abnormal for changes in vitals, what would make you be like a contraindication to continuing activity, and what might just be like a precaution to continuing activity. We talked about intermittent claudication and what it is, how it's brought on, how it's resolved, and how to progress a patient that might have intermittent claudication. Clinical signs of pressure ulcers, we talked about last class. Talked about pitting edema and sensation. Ooh, we talked about ABI. Go back and look at your ABI video from your little cute nurse. Make sure that you know what your ABI ranges are and how you find them. My goodness, my cousins are not working today. We talked a lot about drainage and exudate last visit and today when we talked about integumentary. You need to know the different kinds of drainage that there is, the names for it, be able to describe the qualities and characteristics of those types of drainage. We staged ulcers, and you need to know what stages of an ulcer kind of relate to what clinical signs you're going to see. You know, this one's pink, or this one's super, you know, moist, or this one's black and dry, or whatever. Again, lots of postural drainage. I'll give you a lobe and you get to choose which position is appropriate for that lobe to be drained, or vice versa. The terminology that we went over today, where we're not doing first, second, and third degree, we're now using new terminology. You need to know that new terminology, know what it describes, how deep it goes, what structures are in there, what the division lines between the epidermal, dermal, and subcu layers are. You need to know everything about type 1 and type 2 respiratory failure. You need to know everything about restrictive and obstructive lung diseases. Know where to find all of your different pulse points. That's back from module 1. I think everybody tends to get the tibial one on the wrong malleoli. So go back and take a look at that, and then keep in mind your radial and ulnar ones as well. If I give you a date for wound healing, you have to tell me what phase it was in. More rule of 9s. Me describing ulcers, you picking what kind it is. Airway clearance techniques. We did lots of airway clearance techniques last module in module 2. So you need to know about like coughing and huffing and vibration and percussion and shaking, and what your hands have to do in each one of those types of manual techniques. What's appropriate to use and when you should do things on the inspiration versus the expiration, or vice versa, or all of the above, or none of the above. Know about, we talked a little bit about our diabetic population and about how when they have hyper or hypoglycemic events, how they might feel and how that might relate to their exercise tolerance and their activity levels, things that we would measure on them in those cases. We talked a lot about the structure and anatomy of arteries and veins, what the different layers are called, what's elastic, what's muscular, what's valved, things of that nature. Talked about pulse strengths. So when you see 1+, 2+, 3+, don't automatically think pitting edema, but it could be pulse as well. So think about what would be a 1+ pulse strength. Remember those terms of transudate, exudate, serosanguinous fluid, pus, things like that. Know what they are, what they look like, smell like. Luckily, I won't be making this a scratch and sniff exam. although that does give me ideas for next semester. We did monofilament testing for sensation last week. Know what the equipment is called and what a normal reading would be and what an abnormal reading would be and what would be potentially complicating for a patient that maybe has limited sensation. You know primary functions of all of your different systems, so your cardiac, pulmonary, lymphatic, integumentary systems. We need to, I mentioned it today, but we talked about the migration of the epithelial cells kind of as it closes over a wound and how that process starts and how that process ends, what might prevent it from continuing on or inhibit its progression. Different types of diseases that might have either an arterial or a venous insufficiency component. If I give you a patient with a certain kind of burn, you have to pick the clinical presentation, what you would see with that kind of burn. We talked about how compression might be necessary for some things. It can have an adverse reaction during other treatments for other conditions, so we might have to be careful with it. We talked about polyneuropathy, peripheral neuropathy, diabetic neuropathy. It's a lot of neuropathy for a non-neuro class. Make Diane take it back. What kinds of burns might need skin grafts and which kinds don't need skin grafts, how those skin grafts occur, what PTs and PTAs are allowed to do as far as wound care. Thinking about, when we talked today about splinting, we talked about how, like, if I had an elbow, an anterior elbow wound, I would want to try and splint it in an extended elbow position to help keep the stretch on it so that eventually I would be able to maintain that full elbow extension and not have it be into a contracture. Think about that in relationship to other joints, whether it's like a knee or an ankle or a wrist or hand. You know, how would you want to splint for the most function of that joint, so that if I give you the location of a burn, how would you splint that body part to make sure that it has the most function as it heals? Go and learn all about what those different cells are during the phases of healing. So we talked about like fibroblasts and macrophages and leukocytes, all sorts of stuff. Make sure that you know what each one of those things does when they appear in the healing cycle and what their function is. Another ABI question, there is some calculation required. Again, more obstructive, restrictive pulmonary conditions, more ulcer staging, absolute and relative contraindications to activity, electrical system of the heart, what happens when it fires, where those things are located, what they cause to happen, structurally what happens when we're breathing, remember all that pump handle, bucket handle stuff. Do you remember when we talked, I think it was last week, about different kinds of autolytic debridement happening, where the body goes in and starts cleaning out that dead tissue and kind of cleaning it up. We can also do like an enzymatic debridement. Do you remember me talking about that at all? Where we're like
Mhm.
putting a solution on it to use the enzymes to clean it up. We can also do like a wet to dry type dressing change. So where today we've talked about making sure that the dressings come off really easily. If we're trying to debride, then it would be okay to apply it wet, let it dry out, and then remove it to get that nasty tissue off of it. So that is a technique to be able to debride. We can also use like wound irrigation. Have you guys heard of pulsatile lavage? Think about a water pick with like a spray shield on it. So it has like a little shield to it, and it looks kind of like a little gun with a little trigger, and you just kind of poke and point that little water spout to spray into that area to help kind of clean out and get that tissue to kind of slough off. Spinal cord level for ventilators, coming back to haunt you. All right. Stratum spinosum, layer of the skin. You've got a bunch of receptors in there. I told you guys these names last test, and some of you listened and some of you did not. So I'm going to say them one more time. Meissner's corpuscle, Ruffini's corpuscle, Krauss's end bulb, Merkel discs. If you don't know what I'm talking about, go back to your book and look them up. Typical deformities for different burn victims. So depending on like if it's an anterior burn or a posterior burn, things like that, like what would be the position and posture that they wind up in, thinking about like what's a protective guarded position for that particular joint, to describe what motions that joint might be in. So for example, like the wrist, if I burnt my hand would typically be in a flexed type position, and maybe my wrist would be flexed as well. If that was another body part, think about how that would be. All right, we talked a lot about ejection fractions and stroke volumes and cardiac outputs and things like that from Module 1. You need to go back and review all of those terms and know what happens when and how much is made up of what. Remember me drawing on the board about how this was your total volume and this was your reserve and this was all that kind of stuff. Go back and look at those again. We talked about a lot of general medications for cardiovascular conditions. Remember, I'm not looking for atorvastatin to be named. I'm looking for like calcium channel blockers or nitrates or beta blockers or whatever. Know what they're used for, what effect they have on the body, whether it's like a relaxer of the blood vessels or whatever, to be able to treat different cardiac things. And then we did some special tests early in our first couple of labs where we did like the timed up and go, the 6-minute walk test, the stair step test, things like that. Go back and review those, make sure that you understand how to perform them, what kind of information you gain from them, when it's appropriate to use them, and how you would objectively